Hello, everyone, and welcome to a special episode of Arthritis at Home. Today, Cheryl Koehn, the president of Arthritis Consumer Experts, is joining me, and we're going to look closely at the Ontario election. It's being held on June 2nd. As everyone knows, it's the most populous province in Canada. It also has the largest share of ACE subscribers and members living in that province. Ontario's importance is also underlined by how other provinces closely follow policy making from that government, and that includes healthcare. A recent Ipsos poll conducted this month before the election for the Ontario Medical Association showed that healthcare is ranked as the most important issue for voters, with 1/3 saying it's either the first or second most pressing issue that they consider. I think a reminder for all of us that the most important voices in any healthcare discussion, particularly during an election, belong to those most affected by health policy, and that's the person living with a chronic disease who can provide that very important patient perspective. Cheryl, welcome to the episode.
Great to be here. Thanks for asking me to join you.
How big is that arthritis voice in Ontario?
Well, to use my lay language, it's humongous. It's really significant, Kelly. You know, arthritis patients are a super important part of the voting community in Ontario, where the disease affects 1 in 5 adults, or approximately 3 million people living in Ontario. So arthritis, just as way of background for everyone watching, is the leading cause of disability in Ontario and a significant economic burden related to direct and indirect healthcare costs to the economy. And, you know, people, when they think of costs of healthcare, Kelly, they often think of, operations and ER, emergency room admits, Band-Aids, cleaning, things like that. But it's actually the indirect costs related to arthritis that are the bottom parts, the part of the iceberg you don't see underneath the ocean of healthcare costs. It's a huge, huge driver. In fact, we're the most significant driver. And much of that lies in work disability. So it's a big deal. And it's more than beyond time to address how people with arthritis are treated as they enter the healthcare system in Ontario and move through it. And that's called models of care. So it's a very important issue, and our voice is huge, growing like most chronic diseases, and can play and should play a really important role in the outcomes of elections, frankly, especially this one upcoming in Ontario.
Now, no surprise, over the past month, the 4 major parties, the Progressive Conservatives, Liberals, NDP, and Green Party, have been touring around the province, making all sorts of pledges and all sorts of promises that accumulate to billions of dollars of spending. And obviously, one of the key planks in all of their platforms is healthcare. But sometimes it's tough, I think, for our members and subscribers to really understand what the positions are on health if they're not watching a televised debate, or if they're not going onto a website to try and find these platforms. Cheryl, how is ACE helping people figure out where these Ontario political parties are at in terms of alignment with what the important priorities are for people living with arthritis?
Yeah, it's a great question, Kelly. And obviously, it's a really big piece of ACE's accountability to its membership, to its subscribers, to its supporters, and to the public at large living with arthritis. So I'm glad you asked it. I think firstly, I'll answer by saying we came out while the pandemic is still ongoing. The focus isn't on it necessarily right now, but we spent the last 2 years working with our partners, both Rheumatology Association in Ontario, the Ontario Rheumatology Association, our patient organizational partners, Arthritis Patient Advisory Board of Arthritis Research Canada, Canadian Spondyloarthritis Association, and the Canadian Arthritis Patient Alliance, talking to the Ontario government. We did it virtually rather than, knocking on their door and going into their office physically. But we had a number of productive meetings where I felt, and I think our peers felt, we had a really strong information exchange about how people with arthritis in Ontario, living in Ontario, are accessing and receiving healthcare, and sending a strong message to them, Kelly, that there are big disparities. We learned that from Arthritis Consumer Experts survey work. Predominantly, as you know, last year we ran a very important survey on how virtual care was being delivered. So we've had direct inputs on to the people shaping policy around future delivery of virtual care to ensure that people with arthritis' needs are met. We partnered, as you know, with the Ontario Rheumatology Association, specifically their committee led by Dr. Sahil Kopikar on Northern Health and the specific issues facing Indigenous peoples living with arthritis in the North and others, settlers, colonials. It is a broken model, and actually our community working in partnership have the answers. So to help people with arthritis in Ontario with their voting decision, we're helping them and politicians who are campaigning by asking them a set of questions. People like me in the north of Ontario can't get the kind of care that the evidence, so that the research says they should get. So, whether it's timely and accurate diagnosis, whether it's fast access to a rheumatologist, whether it's appropriate public reimbursement for needed, what we call disease modifying medications, whether they're the genericized small molecules or biosimilars that are really cost effective and as effective as their originators. We've brought to them real solutions, Kelly, to fix those important steps in the journey along the model of care.
I think further underlying what you've described is that when we met with the four major parties last year as a coalition of these patient groups that you mentioned, it was happening in the context of the pandemic.
Right.
And I think the other thing that we found through our survey findings is that during the pandemic, these disparities that you're describing, whether it's people living in the north or in rural communities or people who are members of the BIPOC community, those gaps and discrepancies were worsened during the pandemic.
Yeah, absolutely, Kelly. Thanks for shining a light on that in particular. And because of that, Kelly, it's why we so importantly worked with our key Indigenous advisor, Dr. Terry-Lynn Fox, why we're doing so much work on truth and reconciliation right now, because if we keep looking at delivery of healthcare in the old, settler colonial way, yes, we're going to deliver better healthcare to settlers and colonials, but not to Indigenous people or not to other peoples of color. And if we plan healthcare, let's say, for example, virtual care, which will be expanded and put in permanently in our healthcare system, the same issues we have in in-person care delivery will just be ported over to virtual care, right? That's just the nature of the beast. People do what they're familiar with. Well, our job is to tell people, politicians, candidates, those who get elected, we cannot continue the status quo. It's unacceptable.
Can you talk a little bit and share what these questions were and what they looked like?
You bet. So we asked 5 poll questions of all the candidates. And they're really important questions, obviously, and they are strategically clearly aligned with not only the work we've done, but really focused on the needs of people with arthritis. And we asked them directly, one, what will your government do to bring high quality, accessible, standardized, evidence-based models of care for all Ontario residents? And that includes, how are you going to address Indigenous ways of knowing and being in the way that they wish to be considered in the healthcare system? We're not doing that. We're not doing that at all. And one could argue we're not necessarily doing that for anyone living with arthritis. So we've asked them that directly. How are they going to deliver an evidence-based model of arthritis care for Ontario residents? The second one is, what is the government, what is their government, if elected, going to do to ensure the continuation, improvement, and expansion of virtual care? So we talked about how gaps in in-person care were simply seen as well in virtual care. So both patients and healthcare professionals, they are adamant that the government the party that forms government, or coalition of governments to form the party, or parties form the government, ensure equal access to equitable care to all. Like, that's the question. How do you plan to do it? The third question is, what will your government do to improve the uptake of biosimilars, and would commit to reinvest those savings to support additional medication listings and improve patient coverage? And beyond that, improve models of care. There are, some estimates range from $300 to $400 million to $500 million in the first couple of years if they implemented transition or switch policy. We have 5 governments in a territory that have already done it, and saving and reinvesting already. And so we're asking candidates in Ontario, what are you going to do to act on this? It's a really important piece.
It's an interesting one, because in the introduction I said, how closely the other provinces watch what happens in Ontario. And it's, I think, important for voters to understand that in this particular case, when you're talking about biosimilars policy, Ontario is actually lagging behind other provinces like Ontario, like British Columbia and Alberta and Quebec.
Yeah, so the province that stands to save and reinvest the most money, they've dropped off the back of the pack, well back. The fourth question, Kelly, is so important. And these aren't in rank order, by the way, they're just numbered for purposes of, sort of organization. But how will your government incorporate Indigenous traditional healing practices and beliefs to improve the delivery of care to Indigenous peoples? This specifically is called to action 22, which we're working very hard on within our own organization and our partners under direct guidance of Indigenous scholars. We can no longer think that the settler colonial view on health is the only one, to the exclusion of Indigenous healing practices and beliefs. That the way people view their world context, their land, their life, their family, the trauma intergenerationally faced by Indigenous peoples, these are the things that healthcare providers, it is incumbent upon them. It is incumbent upon people like you and I and those that work at ACE and volunteer for ACE. We must do this work to advance truth and reconciliation. Calls to action 18 to 24 are specific to health. And every candidate, if health is the most important topic at this election, Kelly, as deemed by Ontario residents, every candidate should be sitting down and going to school and understanding the importance of health calls to action 18 to 24.
When you refer to the 3 million Ontario residents living with arthritis, a large percentage of those are living with osteoarthritis. And this last question, I think, really speaks to that population.
Yeah, our government, the government that forms in Ontario, a really important question, and a question, Kelly, being asked of all health ministers across the country, clearly, currently sitting as health ministers, is will your government take steps to ensure timely specialized care for Ontario residents struggling with arthritis, and as you note, predominantly osteoarthritis, including joint surgery wait times that are within medically recommended guidelines? how will your government manage the backlog? So this is in the news almost every day now, not just in arthritis, but I mean, we are hearing day after day about people who have had delayed cancer surgeries, you know, delayed cardiovascular procedures. I mean, arthritis, while people think it's just a simple chronic disease, is also life-threatening and life-taking. So delay in any of these disease settings is really bad. And we now know that while there was a time through interprovincial working groups and joint replacement wait lists, they had sort of what people were calling tamed the wait list. Well, guess what? We now have a raging wait list again. And so we want to know how the government that forms in Ontario, we're asking these candidates to step up and articulate.
I think for our viewers and listeners too, for them to understand that it basically establishes our agenda when we start meeting with the new government in Ontario over the next months and years to come, that these are the areas that we're going to be focusing on. So it lends to our advocacy efforts, and it basically is an open declaration, I think, for the parties and certainly for the government that's formed, that we're going to be coming to them and putting pressure on them to make sure that they show and there's advancement and progress on these key issues.
Yep.
Between now and the election on June 2nd, Cheryl, where can people find the responses that we're getting basically every day from candidates, party leaders, and parties?
So that's easy. That's the easiest question you've asked. They merely need to go to our website, www.jointhealth.org. So jointhealth.org. And as we receive the responses, they're posted directly to our website.
Where can voters and ACE members find more information about these key issues?
Yeah, so it's really important as people read what candidates are saying to have that underlying knowledge to be able to kind of fact check, Kelly, right? How do you fact check what a candidate is saying as to whether it's on track with what the research says should happen for Ontario residents with arthritis or not? So they can go again to jointhealth.org and they can click on the section at the top that says advocacy. And under advocacy, we have 4 sort of really high level priority areas in terms of public policy work.
Thanks for that tour through the election and the election issues in Ontario, Cheryl. And again, the arthritis constituency in Ontario is a very large and potentially very powerful one, but that's only if our members and subscribers and people living with arthritis vote. So we're encouraging everyone to get out and vote on June 2nd. At the end of this episode, we will have a link to where you can go to Elections Ontario and get more information about how you can vote. You don't have to just show up on June 2nd. There's ways to do that in advance polls and things like that. Thanks again, Cheryl.
Thank you, Kelly. Nice to see you, and have a great day, everyone, and be safe and be well. And
Thanks for joining us, and get out and vote.
#vote for arthritis.